Hip replacement surgery is probably one of the most successful operations in all of medicine, and in terms of its ability to restore function and alleviate pain, it really has no parallel in all of medicine and all of surgery. Traditionally, hip replacements have been done through a backside or a posterior approach, and it has worked well for decades. But more recently, there has been interest in an anterior or front side approach. The potential benefits of doing the hip replacement through an anterior approach include the ability to use X-ray, live X-ray or fluoroscopy throughout the entire procedure. This guarantees that the implants that are put in at the correct inclination and rotation and alignment. And the most important predictor of longevity of a hip replacement operation is the appropriate alignment and position of the implants. I think the biggest misconception that people have who are suffering with hip arthritis is that it's a prolonged recovery and a painful procedure. We have had several cases here at Memorial Regional Hospital where patients have gone home the same day of surgery, which is generally unheard of when going through a posterior approach. Part of this is because the approach is essentially muscle sparing, so no muscles are cut during the procedure, they're simply moved out of the way. It works for people of all body types and sizes. One of the main concerns is with obesity, and my personal feeling is that doing the anterior approach is even better for obese patients because there's oftentimes less fat in front of the hip than there is behind, so that there's less tissue to go through, less risk for wound complications and infections. It decreases the need of patients to go to a rehab facility after surgery. All the patients that I do electively go home, usually the next day, sometimes the same day. They often require minimal, sometimes no physical therapy, and their recovery to normal activities is much quicker in my experience. With a traditional posterior approach, patients are advised not to cross their legs. They can't sit in a very low chair or a low car seat for the first 6 weeks because if they do, they risk dislocating their hip. With an anterior approach, I do not tell my patients to have any specific restrictions. They can do anything they want from day one to their tolerance. So our advice to patients now is that if you have significant arthritis in your hip and you've tried conservative things such as anti-inflammatories, activity modification, and physical therapy, if all those things have failed to alleviate your pain, there's no need to continue to suffer with hip pain. The benefit of coming to Memorial for an anterior hip replacement approach is that people who know Memorial know the system as providing top quality care, and now that the system has made a concerted effort to pursue excellence in orthopedics, I think all of the strengths of Memorial are being leveraged to bring cutting-edge orthopedic care to patients in the South Broward community and beyond.